Hey, my name is Leanne, and I'm fascinated with helping women navigate how to eat, move, and care for their bodies. This has taken me on a journey from vegan, keto, high protein to everything in between. I'm a small town holistic nutritionist turned 3-time international bestselling author turned functional medicine practitioner, offering telemedicine services around the globe to women looking to better their health and stop second-guessing themselves. I'm here to teach you how to wade through the wellness noise to get to the good stuff that'll help you achieve your goals. Whether you're seeking relief from chronic ailments, striving for peak performance, or simply eager to live a more vibrant life, this podcast is your go-to resource for actionable advice and inspiration. Together, we'll uncover the interconnectedness of nutrition, movement, sleep, stress management, and mindset, empowering you to make informed choices that support your unique health journey. Think of it as quality time with your bestie mixed with a little med school so you're empowered at your next doctor visit. Get ready to be challenged and encouraged while you learn about your body and how to care for it healthfully. Join me as we embrace vitality, reclaim our innate potential, and discover what it truly means to pursue healthfulness. Hello, and welcome to another episode. I've actually had a lot of people ask me to do a whole episode on this, so here we are. We're going to be talking about birth control, mammograms, pap smears. Yeah, I think that's going to be loaded enough. We got lots to cover. We're told that pap smears, mammograms, hormonal birth control, and even bioidentical hormone replacement therapy are ways that we can protect ourselves, like to avoid cancer, age gracefully. But what if these things that we're taught to fear missing out on aren't the full picture? And come to me, let's put on our tinfoil hats. No, it's not even tinfoil hat territory. What if some of the testing that's being pushed on us and the treatments and the pressure are actually part of what keeps our systems stuck in survival mode? I can speak from personal experience. I will not be getting a mammogram. I had decided that a long time ago. I got one mammogram one time and it was totally useless and painful. And I thought, an ultrasound and a thermography were far more detailed and gave me far better information about my breast health than this chaos. And a pap smear, I was pressured by my doctor to get a pap smear about 6 years ago. She had ovarian cancer and she started crying in the appointment with me, my appointment, because I was saying that I didn't want to get one. And then she emotionally manipulated me to get one. It was very strange. So I got one of those, and personally, I wouldn't get another pap smear. And I'm not saying that pap smears are bad or that mammograms don't save lives or that HRT, hormone replacement therapy, shouldn't be used. What I'm here to ask is, are we using these tools in alignment with our bodies or against our bodies? Because there's a big difference there. And I question whether we are trying to prevent disease or that we're just conditioned for the next thing. So in this episode, we're going to be diving into the 3 big ones: the pap smears, mammograms, and hormone replacement therapy. Not from a conventional angle, because we all know conventionally do the things. And I think hormone replacement therapy is definitely building in popularity, which I think is a good thing and also a bad thing. So we're going to be talking about why that is. I want to take more of a terrain-based view that says your body isn't broken. It's responding to the environment that you've created. And how do we unpack that? We're going to be pulling through the cultural story that tells women to hand over their power in the name of routine care. And I've been there multiple times. I refuse to do it again. I don't know if it's the perimenopause spark that's happened over the last year or so where I'm like, absolutely do not touch my body. I do not want that. No, I don't want that. Get out of here. I want to look at these procedures, what they actually do, what they're using, how they're helpful, what's harmful, and what's missing from the conversation, either an internal conversation that you have with yourself on, do I actually want to do this? And I also want to explore what it looks like to reclaim sovereignty in your health. So when that doctor all those years ago was emotionally manipulating me to get a mammogram I didn't want, was it a mammogram or a pap smear? I think it was a pap smear. Yeah, it was a pap smear. That I could just say, well, I'm really sorry you had that experience, but I do not want to get that. So I want you to think about screening and hormones and aging through a different lens, more of a functional lens of detox capacity and nervous system regulation. So this isn't about rejecting medicine. It's about remembering that medicine is supposed to serve the body and not dominate it. And unfortunately, we live in a system where it's the dominating option. And you deserve to have an informed choice, not a choice made out of compliance or fear or manipulation. So if you've ever felt pressured into a test or dismissed when you asked for alternatives or told, this is just what women have to do, you have to do this, then this episode is for you. Welcome. I want to unpack myths, explore safer options, and talk about what it really means to be proactive, not reactive in your health. Because so many of us are just absolutely reactive and we're waiting far too long to handle these things. So let's start with the first piece of the puzzle, pap smears. What are they and what nobody tells you about them and how a functional approach can really change the game? So from the time that we were teenagers, I remember, puberty started hitting and I was already being poked and prodded and checked, and we're told that our bodies are risky and unpredictable and fragile, that we need a system to monitor us because without it, something terrible might happen. And I remember being put on birth control before I'd even gotten a period because my acne was bad. And the doctor said, oh, don't worry, you'll thank me later. Thank you for 8 years of amenorrhea. While screening and medicine can definitely save lives, and the messaging behind them is quietly saying and shaping generations of, we do not trust our bodies. We cannot trust our bodies. We can fear our bodies, but we can't trust them. Think about the language that we hear. You're due for a pap. You're overdue for your mammogram. It's time to talk about hormone therapy. There's no conversation like, how are you feeling? What is your terrain like? How's your nervous system? It's just assumed that we will be compliant, and compliance equals health. And if you're non-compliant, then you're not healthy. And so many women saying no, or this is not right for me right now, immediately triggers this spiral of practitioners, because deep down, we've been conditioned to believe that good women follow rules and good patients don't question authority. So here's the truth on that. When we surrender our intuition to protocol, we start to disconnect from the signals that our body is constantly giving us. I see this all the time. I've been practicing for 18 years. So many women are absolutely disconnected from their bodies because from a young age, we are taught to disconnect from our bodies. And I'm so tired of it. I'm tired of women just believing that there's only one way to stay safe is to submit. And even when our gut is saying something doesn't feel right, we still submit. Now, a functional perspective challenges that. It says health isn't about as many tests that you complete. It's about how well your body can adapt, detoxify, repair. It's about the quality of your terrain, your liver, your lymph, your nervous system, your gut. If that internal ecosystem is vibrant and supported, you're resilient. Congratulations. If it's congested or inflamed or overloaded, even the most routine procedure can feel like another stressor on top of an already taxed system. And yet, the medical system overall rarely checks the terrain before a test. No one asks, is your liver clear enough to handle contrast dye? Or is your lymph moving well enough to clear radiation or inflammation from that compression test? No. We're told that it's safe for everybody, but everyone doesn't account for your mold exposure, your stress load, the fact that you just moved your mom into a care facility last weekend, your thyroid, your nutrient depletion, your trauma history. What if real prevention started with that conversation instead? How's your mom? Oh, I just moved her into a facility. Was that hard on you? Absolutely. I cried for an entire week. Like, what if you were encouraged to build resilience before being screened, or like strengthening your detox pathways, nourishing your gut, calming your nervous system, clearing stagnation? So a couple weeks ago, I shared that I'm getting my breast implants removed, and I chatted with my surgeon the other day in preparation. I was like, okay, so I've come up with an IV schedule. And he's like, an IV schedule? I'm like, yeah. Like, I'm going to do IVs weeks leading up to the surgery, then the day before the surgery, the day after the surgery. He's like, why would you want that? I'm like, why wouldn't I want that? Like, yeah, to strengthen my detox pathways before you pump me full of stuff, and to nourish my gut, so when I go in there and I'm on all these drugs, I can recover quicker. So when we choose to have a PAP, when we choose to have a mammogram, or we choose hormone therapy, your body can actually handle it, and you actually know what you're doing, and you're empowered, and you're making this choice, and you're like, I'm doing a PAP because I chose, not because I was overdue for one. And that's what functional health is all about. It's not anti-medicine. It's pro-context. It's like saying, I'll take the test, but not before I prepared my terrain. It's saying, I'm not a checklist. I'm a living system, and I can't handle this right now. And I get it. Like, I've had moments where I've felt pressured to say yes to something that really didn't feel aligned, because it was easier than being judged. I didn't want to have to explain myself, and it's easier than having to like defend myself. You know what I mean? Like, the defense thing can sometimes be just overwhelming. You're like, screw it, whatever, just do whatever. This conversation isn't about guilt. I don't want you to feel like if you chose to get a pap smear that you're a bad person. I just want you to choose. And right now, I don't think that a lot of us are choosing, because if we're agreeing to something out of fear, is it through our own body autonomy? Is it over our own sovereignty of our body, or is it something else? So pap smears are presented as routine care. In reality, they're like a cytology sampling procedure that removes superficial cervical epithelial cells for lab analysis. Now, there's no biopsy taken in a pap test. There are concerns with biopsies. Like, if I had a mold that was being weird, I wouldn't biopsy it personally. A pap test is not a biopsy. So you don't have to worry necessarily if there are cells that are concerning, that touching those concerning cells is going to make it spread like a biopsy could. Now, there's like the small plastic spatula and this cyto brush. I know you know what I'm talking about, that little brush that rotated around the exocervix. More like poked, like jabbed, right? Cells are placed either in a glass slide or like fixed in an alcohol solution. And sometimes that contains oftentimes, all the time, it will contain some sort of preservative. I have been researching this, and I get mixed sources on what exactly is on the cyto brush. Some people say there's carcinogens on there, like what's the one? Formaldehyde. And some sources say it doesn't have formaldehyde. I highly doubt, like, we were doing all those COVID tests and they were shoving those things up people's noses. I'm like, guaranteed there's something on there that I don't want on my body. It's very suspicious to me. I was that girl. Of course I was that girl. Now, a PAP is going to detect the abnormalities. It does not treat infection. It doesn't improve immune clearance. It doesn't correct estrogen metabolism. It doesn't change the vaginal microbiome, according to most resources. Like, I've seen individuals go for PAPs and then have yeast infections, UTIs, those sorts of things following. And like, help me make it make sense if there's nothing on that pad, I don't know, or that trauma that creates some sort of infection. But I'm neither here nor there. False negatives can oftentimes occur, and that can be stressful. False positives occur when benign reactive changes are labeled atypical, which leads to a repeat testing or like further testing. Then that's usually when we get into the biopsy situation. Now, I had HPV when I was younger, and I was young, maybe 15, 16. And I chose to get a leap. Well, it wasn't really a choice. I was like, I have this, therefore I get that. And I remember thinking at that point, there has to be something that I'm doing or not doing that's contributing to this. And at the time, we didn't really have the internet. Like the internet was sort of a thing, but we only used it for the thing before MySpace. I don't even remember what that was. And I remember researching B vitamins being very necessary. And so I started taking a B vitamin, and all the doctors were saying, like, chances are when you get HPV, you're going to have it again. And these leaps, you're going to have to do it over and over. I've never had to get another one. Thank goodness. So when we think about terrain factors that drive the abnormal cervical cytology, the PAP is going to pick that up. But why would we wait until a PAP to determine that there's a problem? So most high-risk HPV exposures are controlled by competent cellular immune response. So the variables that tilt toward the perseverance and persistence of poor micronutrient status, like low vitamin A, zinc, chronic psychological stress, low vagal tone, high toxic load from mold or solvents, blood sugar dysregulation, low stomach acid that impairs our protein and micronutrient absorption. These are the functional reasons, okay, that influence our immunity and therefore impact HPV. So instead of humming and hawing over your next PAP, like, oh my goodness, what's it going to say? I'm totally terrified. Why not focus on micronutrient status, vitamin A, zinc, blood sugar? All those things are going to impact it. Let's not wait for a PAP to come back abnormal before we do something. Also, a PAP can be abnormal due to estrogen handling. So high circulating estrogens without efficient hepatic conjugation and biliary clearance increases cellular turnover at the transformation zone. So that's where those cytologic changes are most often detected in these tests. So efficient phase 1 and phase 2 liver pathways plus healthy bile flow and daily pooping reduce our estrogen circulation and therefore reduce our risk of an abnormal PAP. So what can we say about this? Well, we need to support our liver. The best way right now, actually, I had a shower. Okay, here's the flow of my day. I bathed in the sun for 10 minutes aside, got a little sweaty, came inside, did my vibration plate for 10 minutes, jumped in the shower, did all the hair cleaning, came out, slapped some castor oil on my liver. Now I'm sitting here for an hour recording a podcast, and then I'll wash it off. Okay, all of those are drainage pathway processes. And I do take some bile support, bile acid factors, TUDCA, milk thistle, off and on, and weekly coffee enemas. Weekly coffee enemas since 2018. All of these things help with our estrogen handling. Then we have our vaginal microbiome. So lactobacillus dominant flora produce lactic acid and hydrogen peroxide that maintain a low pH and prevent pathogen persistence. So antibiotics, spermicides, scented products, douching, mold exposure, high sugar diets, they shift the flora away from the lactobacilli. And that increases the pH and reduces the mucosal barrier. We want high mucosal barrier in our vaginas, absolutely. And this will raise local oxidative stress. So what can we do? Stop taking antibiotics when we don't need them. I just did a podcast episode on this a couple weeks ago. Stop using the scented products like dishwasher detergent, clothing detergent, in your sheets, on your underwear. Change your underwear to full organic cotton. I made this switch a couple of years ago and it's so awesome. I wear a company called Kaniki. I think they changed their name, or maybe that was my period underwear. I can never keep track of all these companies and who's buying what, but it goes a long way. We got to start thinking about our microbiome, not when we have a problem, but before we have a problem. Element makes it simple to stay hydrated with a clinical dose of electrolytes, 1,000 milligrams of sodium, 200 milligrams potassium, and 60 milligrams magnesium. No sugar, no junk, just what your body actually needs. As a practitioner, I love that Element offers a raw, unflavored option, perfect if you're avoiding sweeteners or additives. It's an easy go-to for supporting adrenal health, proper muscle function, and overall hydration, especially for those on a low-carb diet or fasting protocols. Whether you're training hard, working long days, or just prone to feeling sluggish and depleted on a low-carb diet, this can help. Right now, Element is offering a free 8-stick sample pack with any purchase. You'll get to try their most popular flavors, including citrus, raspberry, watermelon, and orange. Go to drinklmnt.com/KDP for your purchase and get your free 8-stick sample pack. Again, that's drinklmnt.com/KDP. So I talked a little bit about the whole PAP situation and whether or not it was affecting the actual epithelial surface, because scraping creates a micro injury in the epithelial surface. And in most women, this is trivial. And in inflamed terrain, you can see transient spotting, reactive discharge, pelvic floor guarding, short-lived disruption of the vaginal flora. For women with pelvic trauma from the past, we can have significant mast cell activation, nervous system activation issues. And what I was able to find is that laboratory fixatives are alcohol-based or methanol-based, sometimes with trace formaldehyde derivatives in certain liquid exposures. So that little pad that they say that they just wipe, but it's more of a stabbing. It may not be in every pap smear, but chances are one of the paps you've had, they've wiped a little bit of formaldehyde on there, which is a known carcinogen. And if you are hearing me say this and you're like, I hate paps, the paps suck, what do I do instead of paps? Like, it's not a what do I do instead of a pap smear? It's what do I do to keep my terrain healthy that I don't necessarily need to have a pap smear if I feel led to do that, like myself personally. And you might think, Leanne, you're absolutely crazy. Why would you not get a pap smear? The cool thing is I've looked at everything and I've decided for me, I don't want that. Thank you very much. So here are some of the daily foundations. Like we've already talked about the estrogen piece, the liver piece, okay, the nutrient piece, but let's go through all of it. Daily foundations. Protein at each meal. We need amino acids that rebuild the mucosa and support detox enzymes. 30 to 40 grams of fiber per day from vegetables, legumes, chia, flax. Those help to bind the estrogens and the bile acids and everything. Cruciferous and sulforaphane veggies to help with estrogen metabolism. We have minerals to help with immune competence. Zinc, selenium, magnesium, fat-soluble vitamins for our mucosa and immunity, like vitamin A. Oh, so many women are lacking in vitamin A. It is crazy. Vitamin D, I like it, but especially it has to be paired with vitamin K2. We need polyphenols from green tea and berries for the antiviral and antioxidant support. You'll notice if you follow me on Instagram, I eat a lot of different colored berries like cherries, cranberries. I'm known to just snack on some cranberries when I need a little snacky snack. And they're so sour and so good. And they're rich in polyphenols and really help with actually the acromancy on our gut, which help with that mucosal lining. Parasympathetic practices daily like nasal breathing, humming, gargling, short exhale practices to increase vagal tone, all of those things, so helpful for just a daily foundational support. Then we get into the targeted support around HPV or persistent cytology. EGCG is my most favorite thing. This is a green tea extract. So if you've had issues with HPV in the past, necessary. Folate and B12 to support methylation, necessary. Like I said, when I was 15, I was like, there's got to be something wrong with this. And the books that I was reading, and I think I may have found it on some thread, a text thing that like chats. What did we have then? Like MSN chats, maybe? I don't even remember. That was a long time ago. N-acetylcysteine can also be helpful. Any glutathione precursors for redox balance are perfection. Topical or intravaginal probiotics like lactobacillus, oof, that stuff is good. I would absolutely avoid fragrance products, harsh cleaners, tight synthetic underwear. I do not know how girls at the gym wear no underwear in between themselves and those tights. That's going to mess up your pH, something fierce. Just wait. Then we go into like self-collected high-risk HPV stuff. Vaginal microbiome mapping, you could definitely do to just assess for pH and pathogen load. I don't have a lot of experience in that, but I have seen this more and more and more. These give you a lot of information about terrain and viral risk without instrumenting the cervix and understanding like it's far less invasive. If a self-test is positive, then I would repeat it before perhaps going in for like further testing. But like preparation for 3 to 5 days improves tolerance and recovery. So if you are deciding like, Leanne, super great, happy for you, you don't want to get a pap, but I do. Here's what I would do to prepare for a pap smear. I would do vitamin C daily, N-acetylcysteine, like 600 milligrams twice daily for at least a week, magnesium glycinate, zinc, castor oil pack over the lower like abdomen, gentle pelvic floor training. And the day of the test, I would arrive super hydrated, good food in my belly, and request a plastic speculum. Request the smallest brush and ask for a single gentle pass rather than repeated scraping. That's what I would do. And then, of course, after like pelvic floor relaxation, a probiotic suppository I would probably do, and perhaps another castor oil pack in the evening. And I would definitely skip intercourse, tampons, internal products, anything inside other than that probiotic for like 48 hours. So here's like a decision-making framework that you can reuse. 1, what is my current cervical and systemic terrain? Am I ready for this PAP? Or do I need to like regulate a couple things before? 2, is there a non-invasive way to answer a question that I have? 3, if I proceed, what will I do before and after to protect my body, my flora, my nervous system? And 4, what threshold will actually change my plan? So if the result will not alter action, then don't do the test, right? I've had so many people say like, I got the test, but I wasn't going to act on it anyway. Why'd you get the test? Why'd you get the test? I think pap smears are a tool for cytologic surveillance, but they do not create health. And we cannot rely just on a pap to be like, oh, great, now I have a problem. No, ma'am. No, ma'am. We should be doing all these things and caring for ourselves well before that pap. Okay, let's move to mammograms. I hate them. Everybody does, just like paps. The message is often, if you care about yourself, you'll get one. And if you don't, you're gambling with your life. In fact, I have a friend who works for the Cancer Society. I won't get into details about what that looks like or anything. But when I was having a conversation with her about alternative therapies, and she knows her stuff. She's involved in a lot of stuff. And none of the things I was saying out loud, she had even heard of. And I'm like, how? Okay, yeah. I mean, it's just a different process. It's a whole different world with all of that. And breast tissue isn't meant to be smashed flat. It's vascular, hormonal, lymph-rich. It's dense with immune cells and microcapillaries. I would know. I've had implants pressing up against mine for 11 years, and I can't wait for my microcapillaries to be free. When you compress it between plates, you're not just taking a picture, you're pushing lymph fluid out of this tissue, collapsing the natural drainage that detox the breasts. And that stagnation can linger for days, sometimes weeks, especially in women who are already massively sluggish in lymph or have dense fibrotic breasts. And functional practitioners see that congestion show up as tenderness, swelling, fatigue, especially after imaging. Signs that the lymph is overwhelmed. And if your detox systems are already under pressure with metals, liver congestion, estrogen dominance, mold, it's just one more thing to hit your terrain. So there's also radiation to a mammogram. Like a standard mammogram delivers a small dose, but radiation exposure is cumulative and it hits fatty glandular tissues pretty hard. And fat tissues are what store toxins and radiation. And adding ionized radiation to the mixture of toxins, you increase the oxidative stress locally. In fact, I worked with a client who was under a program that they were releasing. It might have been in Canada. I can't recall. And they had monthly contrasted mammograms. monthly to avoid breast cancer. And I'm like, what? No. In a healthy, antioxidant rich woman, this is unnecessary. But most women being screened are already inflamed, nutrient depleted, overloaded with environmental xenoestrogens. Their glutathione and manganese SOD systems are already working overtime. So yeah, the oxidative load from even a small dose of radiation, a small squishing of the boob tissue, is a big deal. And functional medicine always asks, what's the state of the terrain receiving the insult? And if it's weak, inflamed, or toxic, the damage compounds. The damage compounds every single time. So some centers are now pushing contrast enhanced mammography. So this is basically intravenous iodine dye paired with digital imaging. And here's the issue. The iodine contrast isn't neutral. I've seen some pretty crazy ongoing stuff happening here. It stresses the thyroid, can irritate the kidneys, and cause a lot of skin irritation and skin diseases, actually. It adds yet another detox burden for anyone sluggish with methylation or with poor sulfur metabolism. Most women just aren't screened for any of that first. They don't know whether or not they have it. So we've got a population of women who are underperforming livers. They have backed up lymph, poor hydration, no antioxidant prep. They're being injected with iodine, hit with radiation, smashed boob tissue, annihilating their lymphatic system. Yeah, that sounds like a solid care plan. Like, I know I sound a little spicy. I'm so tired of this. And I hope that if you're listening, you're like, yeah, me too, let's go. And not like, who is this chick? She's stupid. A functional or terrain-based practitioner doesn't start with imaging. They start with biology. They ask, is your liver moving bile efficiently? Is your thyroid balanced? Is your ferritin in range? Does your vitamin D look optimized? Are your estrogen metabolites clearing through 2-hydroxy and not 16-hydroxy pathways? Is your lymph moving? Do you sweat? What's your copper to zinc ratio, your selenium, your iodine status? Because all these things tell you more about your breast health than a yearly radiation zap will ever tell you. So then if the answer to some of those questions is not great, then we're going to do vitamin C and glutathione and NAC and selenium, magnesium, hydration. If you have to do contrast, we're going to add molybdenum, taurine, glycine for iodine clearance. And after imaging, we're going to add castor oil packs over the breast or liver, dry brushing, infrared sauna, binders. That's not paranoia. It's just basic cellular hygiene. Breast tissue also stores emotion. And I am going through the process of breast implant removal. At the time of this recording, I am 8 weeks out from the surgery, but by the time this goes live, I'll be about 4 weeks out from the surgery. And literally, I've been checking my energetic and emotional terrain constantly because breast tissue stores so much emotion. And I fully expect before or right after my breast implant removal, there's going to be a lot of emotion gunk. From an energetic lens, this area relates to nurturing, boundaries, and safety. And fear-based screening floods the system with cortisol and adrenaline before you even step into the clinic. I remember going for that mammogram and being absolutely terrified. That chemistry constricts fascia, shuts down lymph flow, creates microstasis in exactly the tissue that you're about to image. So every year, millions of women walk in tense, braced, afraid, and then get told that it's preventative, but it's not. It's conditioning. A body in systemic overdrive doesn't heal, it hardens. If you have any issues with not sweating, your lymph not moving, your liver not clearing, let's start there before we zap ourselves with radiation. Does that make sense? So there are better ways to watch the terrain. Thermography specifically detects vascular and temperature changes years before a lump appears. No compression, no radiation, costs maybe $150. You find yourself a good thermography lady and you hold on to her for dear life and you see her every year. Breast ultrasounds show structure safely and especially for dense tissue. Salivary and urine hormone testing like Dutch reveal estrogen metabolism and detox balance. Lymphatic mapping through infrared or manual assessment shows if drainage is stagnant. These 4 things, essential, part of my day-to-day. Combine this with the complete picture of blood work and understanding your biology, chef's kiss. So if you've already had mammograms, it's not like you need to panic. What's done is done, and you can focus on restoring your terrain. But DNA repair with NAC, glutathione, alpha lipoic acid, upregulating detox, sweating, hydration, minerals, antioxidants, and start transitioning to the idea, like do some research, thermography, ultrasound, especially if you want to step out of that fear cycle and take control of your body. That's what I personally do. I feel very, very good about it. Now, mammograms are not evil. I see them as being incomplete. They don't measure inflammation or oxidative stress or estrogen detox. We are pushing our bodies, like the standard woman is doing way too much in a day, way too much, way too many commitments, way too much happening. And she pushes herself until there's nothing left. She's gained 80 pounds in 2 years. She's completely lost herself, right? And then she goes into a mammogram because, mama needs to take care of herself. And now she has a lump and she's freaking out. Well, yeah, like something's got to give. And we need to support our bodies so we don't need these crazy tests. It's not rebellion, it's intelligence. Pepti-Strong is a clinically studied complex of peptides derived from Vesica faba, chosen for their ability to activate mTOR and inhibit muscle degradation. These peptides, which have a really long name, we'll go through it. It's HLP-SYS, PSPQ, and TIKIPAGT, have been shown in human and animal studies to increase protein synthesis, reduce TNF-alpha, and preserve lean mass during inactivity. Now, most women over the age of 40 lose 1 to 2% of muscle per year, which accelerates metabolic slowdown, insulin resistance, and bone loss. FIT intervenes here, not by supplying more protein, but by turning on the body's muscle building machinery. Carolyn, age 43, writes, within 3 weeks, I noticed better strength recovery and less muscle soreness, especially before my period, when I'm usually weaker. You don't have to accept muscle loss as being inevitable. Take control of your strength and longevity by going to healthfulpursuit.com/make. You can grab FIT today and subscription save 10% on ongoing orders. And after your 3rd order through my link, you get 20% off ongoing and you can cancel anytime. Again, that's healthfulpursuit.com/make. Okay, let's get to hormone replacement therapy. This is really the 3rd pillar of conventional women's care, and I would put it into conventional because a lot of practitioners are still using like birth control as a means of hormone replacement therapy. In mainstream medicine, HRT is sold as an answer to menopause, mood changes, bone density loss, hot flashes. You're told that when women's estrogen drops, everything else follows, like skin, libido, sleep, metabolism, and that the fix is to replace what's missing. That might be the case for the individual. Hormone decline is not a disease. It's a shift in signaling caused by metabolic, mitochondrial, and adrenal adaptation. So when the ovarian output decreases, the adrenal glands and peripheral tissues are meant to take over a portion of production. So that handoff can oftentimes fail when cortisol is chronically high, liver detoxification is compromised, or micronutrient stores are depleted. So low hormones on a lab test doesn't always mean that the body can't make them. Oftentimes it means that the system is prioritizing survival over reproduction or over balancing of hormones. Hormones are like way down on the list of priorities for the body. Like, get it out of here. Who cares? And though hormone replacement therapy can make us feel okay, right? It's not going to be the be all end all for us. I have not seen that. I think it's a be all end all for individuals who get a complete hysterectomy for sure. Like that'll be fantastic because you hit menopause overnight. All of a sudden you're in menopause. That shift is a lot much. So when estrogen or progesterone is added to a body that can't metabolize or clear them, 3 predictable patterns start to appear. estrogen recirculates. Like how many times I've worked with clients and their gallbladder was removed in their 30s, and then they experienced menopause and their practitioner put them on estrogen. And when we test their estrogen, it's like 400. I'm like, you don't have proper bile clearance to clear the estrogen you're supplementing with. This is bad. If a bile is thick or bowel transfer is low, or beta glucuronidase is high from dysbiosis, or your gallbladder was removed, or conjugated estrogens or deconjugated and reabsorbed over and over and over and over and over, you see bloating, breast tenderness, mood volatility, water retention, ding, 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 estrogen recirculation. And we can also see methylation overload, because phase 2 liver pathways use B2, B6, B12, folate, choline, magnesium, all to neutralize hormones. So when those nutrients are low, estrogen metabolites back up, increasing oxidative stress and DNA adduct formation, which ain't a good thing. There can also be an adrenal mismatch of like sex hormones, and the introduction of them into a system running on adrenaline or cortisol actually suppresses the endogenous signaling even further. So women feel super wired but tired and have a lot of emotional highs followed by crashes, insomnia, fluid retention. So adding in hormones without clearing the terrain first can oftentimes amplify the same imbalance that created the deficiency. Right? Like, let's talk a little bit about bioidentical versus synthetic, because synthetic estrogens are basically conjugated equine estrogens, bind receptors more tightly and stimulate hepatic clotting factors, which will raise our thrombotic risk. Whereas bioidentical estradiol, like E2, estriol, E3, and micronized progesterone match human receptor shape, but delivery like still really ultimately matters, because oral will pass through the liver first, which will elevate sex hormone binding globulin, which is basically these little Velcros that run through the body and make it impossible for hormones to do what they need to do. So oral progesterone, like when I see somebody taking oral progesterone, I'm like, wah, wah. It's not great. Transdermal, so this will bypass the liver, providing steadier levels and lower clot risk. Specifically, we're speaking of estrogen. And then pellets, they deliver little baby doses for many months. They're really hard to titrate and they're often way too high. I would not get a pellet inserted in me for any reason when it comes to hormones. It's just, once it's in there, and you just kind of got to ride it out. So if I were, now I'm on DHEA. I've been taking DHEA for quite some time. I feel really good on it. DHEA will convert into estrogen and testosterone. So I feel very supported in that as I experience the beginning stages of perimenopause. Progesterone cream is what I would go for. And I would also do like an estrogen topical before I did any oral myself personally. So let's talk about all the things. I just said everything sucks and don't do it. Here's what a functional practitioner would do, really, is rebuild. Look at sleep, circadian rhythm, cortisol curve, support mitochondrial energy, magnesium, CoQ10, carnitine, B vitamins, correct digestive dysfunction, make sure there's adequate stomach acid, bioflow, daily bowel movements, fill up nutrient stores, zinc, selenium, choline, taurine, sulfur-rich amino acids, which help with estrogen detox. Evaluate phase 1 and phase 2 detox. Dutch will do a great job at this to understand what hormones are happening and what's happening there before you even add the hormones. Phase number 2, what a functional medicine practitioner might do is like a gentle modulation process. So using like plants and adrenal adaptogens to restore rhythm, like maca or vitex or rhodiola. If symptoms persist, we could even introduce DHEA or pregnenolone in microdoses. I love me some DHEA. It is nobody uses it, and I don't understand because it's so great. Continue tracking energy, sleep, cycle markers, and then phase 3, maybe bring in HRT if needed. So when the terrain is balanced and we have good bile flow and balanced cortisol and clear detox, then maybe a little bit of estradiol, a little bit of vaginal progesterone. Perfect. then we would retest estradiol, progesterone, and see what it looks like in 8 to 12 weeks. But let me tell you, phase 1 and 2 of rebuilding and modulation, I mean, this is months of work. And I think people are just impatient, and a practitioner says, hey, we can get you on progesterone. And then they're like, well, that's easy. Yeah. And then they go on progesterone and they feel great for 2 months, and then they don't feel good again. And then we're back to where we are. So here are some tests that I would run if I were doing this. I would do a Dutch panel, cortisol awakening response maybe, GGT, ALT, AST, bilirubin for the hepatic load part, homocysteine to assess for methylation, copper to zinc ratio to assess for oxidative stress and estrogen receptor reactivity and sensitivity, iodine and selenium, important. You test that in blood work. Many symptoms blamed on low hormones are actually a result of terrain issues. Like hot flashes are often linked to issues with hypoglycemia or hyperglycemia, cortisol spikes, issues with spicy foods, food choices, stress. And this can be way better stabilized with chromium or magnesium or balanced meals than doing HRT, which is expensive and a lot. Insomnia, which is common as we are experiencing perimenopause, is often driven by nighttime cortisol and low GABA. So it can be improved with taurine and phosphatidylserine instead. Vaginal dryness, oftentimes due to low DHEA, like topical DHEA or vitamin E suppositories do amazing work there. Mood swings, often tied to blood sugar, B vitamin deficiency, low progesterone precursors like magnesium, for example, or B6. So if HRT is used, I would pair it with things like N-acetylcysteine, glutathione, omega-3s, vitamin E, magnesium, taurine, DIM, calcium DG, all things to help with recycling antioxidants, membrane integrity, smooth muscle relaxation, bioflow, all those things. I would hold off on any type of hormone therapy if you have active mold issues, SIBO, chronic constipation, gallbladder congestion, unresolved estrogen dominance issues, unregulated thyroid, weird adrenal responses, elevated inflammatory markers. Correct those first and then evaluate for hormone replacement therapy, because I love it. I use it in my practice. I think it's great, but it's more of a maintenance process than a fixing solution. It's not going to fix something. It's just going to correct some of your symptoms after you've restored balance to the body. So we have covered a lot. I didn't bring a drink into my office. I'm parched. Pap smears, mammograms, hormone replacement therapy. Each one was created to detect or replace, not to restore. And I think that's ultimately the problem as a functional medicine practitioner that I see day in and day out when I work with clients. The order really got flipped. Modern medicine starts with surveillance and substitution, and functional wellness starts with systems and sequence. And I'm on the functional side of things, which thank the Lord. That's why I don't need to go to the doctor and do all the things, because I try to maintain that functional space. And yeah, it's hard. It's a moving a big boulder up a steep hill when you're working through all this. And it's hard, but it's worth it because the harder you push that boulder up, then the stronger you are, the more resilient you are, and the more you can handle in your body. So if you take nothing else from today, take this. Health isn't built in an exam room. It's built in the daily chemistry of your cells. So if this episode was challenging for you, I'm sorry. That's kind of the point, I guess. And if you want to share it with another woman who you think may resonate with this, great. And if you think I'm crazy, cool. I'll just be over here balancing my mitochondria. Okay, I'll see you back here for another episode. I hope you enjoyed it. Bye. Thanks for listening to the Healthful Pursuit Podcast. Join us next Tuesday for another episode of the show. If you're looking for free resources, there are a couple of places you can go. The first to my blog, healthfulpursuit.com, where you're going to find loads of recipes. The second is a free parasite protocol that I've put together for you that outlines symptoms, testing, and resources to determine whether or not you have a parasite plus a full protocol to follow to eradicate them from your life if you need to. That's available at healthfulpursuit.com/parasites. And last but certainly not least, a full list of blood work markers to ask your doctor for so that you can get a full picture of your health. You can grab that free resource by going to healthfulpursuit.com/labs. The Healthful Pursuit podcast, including show notes and links, provides information in respect to healthy living, recipes, nutrition, and diet, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Healthful Pursuit podcast reflects the most up-to-date medical research. Information is provided without any representation or warranties of any kind. Please consult a qualified health practitioner with any questions you may have regarding your health and nutrition program.